Could we avoid a majority of the health cases that we are seeing in our hospital through the implementation of digital health technology? That's what we're talking about with Ryan Sanderson, who's joining us next.
The more you listen, the more you'll know. Power 98.7.
Ryan, good morning and thanks for your time. Hello, Ryan.
It's my pleasure. Good morning.
Good morning. Thank you so much. Ryan is in South Africa
morning.
at the moment. He is the exhibition director of African Health Exhibition and Conferences. A World Health Organization report published in 2018 stated that within Africa, about 15% of all hospital activity and expenditure was as a direct result of adverse events, and that the costs of treating safety failures amount to trillions of dollars each year. The investments needed to improve patient safety pale in comparison to the cost of harm. Ryan, you've seen this report. What does this tell us about the state of the quality of healthcare in South Africa?
Well, it's a great question, and I think if you look at what's been happening internationally with the advancements of technology, and if you look at the way that these solutions are actually being implemented into hospitals around the world, in sort of other more international countries, the difference that it makes to the quality of patient care is significant. It also obviously it massively contributes to reducing the time in hospital. That obviously reduces costs in hospitals. South Africa has got a unique healthcare system. It is world class in my opinion. The difference is, though, I think if we start to look at ways that these digital solutions can actually be implemented, I think we will definitely see the healthcare system just move to the next level, and that's definitely applicable for South Africa as well as all the neighbouring sub-Saharan countries who arguably might even stand to benefit more from adopting the digitization movement.
Yeah. How well are we doing in terms of health infrastructure in the hospitals? I mean, we speak a lot here on our radio station about Bara, for example, in Soweto. We've got Kalafong in Tshwane. We've got Pulusong in Tsakane. And the issue here, most of the time, for example, when we hear about the rest of the hospitals in KZN, the oncology department, they're lacking the necessary machines, infrastructure to deal with those issues. I mean, how bad are we in as far as investment in infrastructure at our hospitals?
Look, I think one of the crucial things to think about is, a lot of African countries are facing rising populations. These populations are growing pretty significantly. You also look at just general life expectancy and obviously the increases that have been made over the last couple of decades. Those two factors combined put a lot more pressure on the infrastructure that's already in place. It is a bit of a tragedy to see departments that are that are under-resourced and also don't have the correct level of infrastructure. It's naturally an area that needs to be looked at, and it's an area that needs to be invested in. I think there has been some positive work coming out of the government in terms of policy, just about sort of trying to limit the impact that under-resourcing and under infrastructure has got. But it's not a perfect science. I'm certainly not in a position to sit and to chastise the system. It's the reason why shows like Africa Health are so important, in my opinion, because we are bringing an international audience to South Africa, and I think there's a lot of they've got the ability to solve an awful lot of these problems, whether it's looking at ways, sort of different payment models for very expensive high-end equipment. I know that's been a trend over the last couple of years. The role that public-private partnerships can play in improving the hospital infrastructure is also significant. So, I think a lot of the work that we do as an exhibition organizer and as a market maker is bringing together all these key stakeholders to really sit down and to explore solutions to make sure that what is happening in the example that you mentioned in KZN doesn't happen in the future, because as the population continues to grow, the hospitals are going to be put under even more strain and even more pressure. So these are things that need to be improved as a matter of urgency.
Yeah. While this remains a challenge, as you are putting it, in developing nations in general, especially on the continent, we do like sometimes to look at how other countries are doing it, like Rwanda, which you say, by the way, is a pioneer when we're talking about digital health in Africa. How are they getting it right?
I mean, it's incredible if you actually look at what's happened in Rwanda over the last quarter of a century. Obviously after what happened in 1994, the country was put under an awful lot of pressure, and I think they almost kind of had a blank slate, and they had to start rebuilding infrastructure and systems. I think there was a